First of all, the features of external ear. As we all know that ear is an organ of hearing and human ear is more sensitive to sound frequency ranging between 1500 to 3000 hertz, and it consists of the ear which is divided into external ear, middle ear and internal ear. And we can see here, this is the external ear. Here comes the external ear, this is the part of external ear, and here comes the middle ear, and here forms the inner ear. This is the external ear, middle ear and inner ear. And here in this diagrammatic view also you can see that this is the part of external ear, inner ear, and this is the external ear, middle ear and inner ear. Here it consists of auricle and the external acoustic meatus. The auricle, which is also called the pinnae, it is a single piece of yellowish elastic cartilage continuous with the cartilaginous part of the external acoustic meatus and absent in lobule of the ear. The cartilaginous part which is absent, this part which is called the lobule, it is absent in the lobule of the ear. Features of auricle. This region, this thickened region which is called the helix, and here comes the next thickened region which is called the antihelix, and the region here found, this is the targus and this one is the antitargus, and the area of this fossa like part which is called the conchae, and this is called the supraconchae, and this region or this fossa like extended fossa like region which is called the xiphoid fossa, and this is the triangular fossa. Okay, and this part which is called the lobule. So it consists of helix, antihelix, targus, antitargus, conchae, supraconchae, then scaphoid fossa, triangular fossa and a lobule. And here is the external acoustic meatus or the auditory canal. It extends from the bottom of the conchae. We know that which is the conchae part of external ear or the auricle, isn't it? So it extends from the bottom of the conchae to the tympanic membrane, this bluish color which is called the tympanic membrane here. So extend from the bottom of the conchae to the tympanic membrane, and its length is about 24 millimeter. Okay, and it's subdivided into two parts. Here we know that the auricle which is continuous with the, we already said that the auricle is continuous with the cartilaginous part of the external acoustic meatus, isn't it? So here consists of latter part, latter 1/3 is cartilaginous part and the medial 2/3 which is called the bony part. So it is subdivided into cartilaginous part and a bony part. It consists of a lateral end and a medial end. The lateral end form the bottom of the conchae, and the medial end there is the tympanic sulcus, there lodges the tympanic membrane, and this membrane which is attached obliquely. Okay, and it consists of a roof, floor, this is the posterior wall, and here comes the anterior wall which covering attaching to the this part, the roof and floor, this part, and we can see a part here, this one is the posterior wall. So it consists of lateral end, medial end, a roof, floor, posterior wall, and covering here region which is called the anterior wall. The posterior wall which is lined with the skin, and here the tympanic membrane which consists of an outer and inner surface or external or lateral or medial surface. The lateral wall which is directing towards the external ear, and this region which is covered with a skin. Okay, and so The posterior wall is continuous with the skin or with the cuticular layer of the tympanic membrane, and here consists of a serumous glands. Serumous gland which secretes cerumen. Cerumen means wax. It secretes wax to prevent the maceration of the epithelium and warm humid for effective vibration of tympanic membrane. Blood supply of the external ear. Here the blood supply is by anterior auricular or the superficial temporal artery, or anterior auricular artery, posterior auricular artery which is a branch of external carotid artery, deep auricular artery which is a branch of maxillary artery, anterior auricular which is a branch of superficial temporal artery, posterior auricular is a branch of external carotid artery, deep auricular which is a branch of maxillary artery. Then venous drainage, the vein drains into the external jugular vein, maxillary vein and to the pterygoid plexus. And nerve supply, the roof and anterior wall which is supplied by the auriculotemporal nerve, and the floor and posterior wall which is supplied by the auricular branch of vagus. Applied anatomy of external ear. First one is otitis externa. It is an infection of outer ear canal that runs from the eardrum to the outside of the head, and it often caused by water remaining in the ear after swimming. This creates a moist environment that help bacteria or fungal grow. Okay, next one is the wax, ear wax. We all know that about the ear wax. If it get filled, we get irritated, isn't it? And while removing also we will get irritated, cause coughing and vomiting. It irritates the auricular branch of the vagus. Okay, the ear wax will irritate the auricular branch of vagus. And next one is the de-wax. De-wax means removal of wax. Here we can apply a syringing method. A syringing the ear with warm water is advisable to remove the wax. Okay, if we use cold water, it induces cardiac arrest by stimulating the vagus. Next is the foreign body. The foreign body can be entered into the external ear part, into the external acoustic meatus, and get irritated.